This is a presentation on the intravenous line insertion and arterial blood extraction, prepared by Katrina Soriano. The following are the steps for IV insertion. Step 1. Secure consent, and this is usually done by a nurse. Next, we must wash our hands or use a hand sanitizer. Then, we must prepare our materials. The following are the materials we need to prepare for an IV insertion: an IV cannula, infusion set, extension set or saline flush, clean, non-sterile gloves, tourniquet, micropore, cotton, rubbing alcohol, sterile gauze, a splint, and a tray. Next, we must introduce ourselves to the patient, confirm the patient's name, explain the procedure, and gain consent. Begin by wearing clean, non-sterile gloves and set up the materials on the field. Prepare your saline flush or prime extension set or infusion set. Inspect for a suitable vein. Apply your tourniquet. Then palpate your vein and stabilize the selected vein. Moving in concentric circles, coming from inside to out, swab the puncture site with alcohol. Clean it for 30 seconds and then allow it to dry. Prepare the cannula. Bevel up, making sure that the needle is directly above the selected vein. Insert the needle at 10 to 30 degrees. Observe flashback of blood. If it is present, it means you are in. Withdraw your introducer needle. Advance your cannula into the vein. Then, release your tourniquet and remove the introducer needle. Dispose of your sharps appropriately. Attach the infusion set quickly, attach extension set, and replace cap. Place a 1x1 sterile gauze at the insertion site and tape securely. Loop your tubing and then secure with tape. Flush your cannula. Apply your cannula dressing and then apply your splint. Instruct your patient on how to take care of the IV site. Dispose of your gloves and all clinical wastes appropriately. Finish by washing your hands again. The following are the steps for arterial blood gas extraction. First, we must secure consent. This is typically done by the nurse. Next, wash our hands and gather all necessary materials. The following are the materials that we need for the arterial blood gas extraction: a blue 22 gauge needle, a 2 ml syringe with heparin, a cap for the syringe, a plastic bung, a local anesthetic, alcohol, gauze, gloves, and a sharps bin. Introduce yourself to the patient, confirm the patient's name, explain the procedure, and gain consent. Position the patient's arm with the wrist facing up. Locate the radial artery with your index and middle fingers. Perform Allen's test. This ensures the blood supply to the hand should the ABG cause a blockage in the radial artery. Put on your gloves. Attach the needle to the heparinized syringe. Prepare your local anesthetic and give a small amount over the palpable radial artery. Remove the cap of the needle, flush the heparin through the syringe, and then again locate the radial artery using your non-dominant hand. Inform the patient that you're about to proceed and to expect a sharp scratch. Insert the needle at 30 degrees at the point of maximum pulsation of the radial artery. Advance your needle until arterial blood flushes into the syringe. Remove the needle and syringe by placing the needle into the bung. To stop the bleeding, press firmly for 5 minutes over the puncture site using the gauze. Remove the needle and discard safely in the sharps bin. Cap your syringe, push out any air within it, and send immediately for analysis, making sure the sample is packed in ice. Remove your gloves, dispose it properly in the clinical waste bin. Finally, wash your hands.